Hello and welcome to our today's webinar series. My name is Matthew Klinsky. We'll wait a few more minutes just to let a few other people catch in. We'll start in about 1 minute. Very good. Well, welcome everybody to today's webinar series. We're going to be diving into the Proforma and how important it is for medical practices, especially as they're starting up from scratch or from starting a new location or service line. My name is Matthew Klinsky. I'm a physician, internal medicine and pediatrics by training. Practiced for about 7 years, and currently I work with Doctors Management as a senior management consultant. I work with startups throughout the country in all specialties, in all states. We also work with existing medical practices to help optimize and grow their practice. So without further ado, let's jump into the topic for the day. Go ahead and share my screen. Right. So to start your own private medical practice, one of the things that we're doing in our 4-part series is really breaking down what are those steps that are needed for physicians, nurse practitioners, providers to start their own practice. And so we have a 4-part series. Today is the second portion, which is evaluating the Proforma. So again, my name is Matthew Klinsky, and I'll be your host. We were hoping to have another consultant on, but he was not able to join. So this webinar, for those of you who may be watching who are not a clinician looking to start their own medical practice, this may not be perfect for you. But if you are a clinician, you're looking to start your own medical practice, then this is you're in the right spot. Today's medical practice world is changing every year, every couple of years. We're seeing that the startup of medical practices, the private medical practice, has been declining. In the 1980s, for example, we were at 76%. In 2024, we were down to 42%. There's so many variables to that the decrease in private medical practices. And so our goal, our mission is to help educate those who are thinking about starting the medical practice and to help them to do it. This webinar is part of a 3-part educational component. We sent out a blog. If you haven't seen the blog, this is the blog that we are referencing throughout the webinar. It's a point of kind of education, which is the costs to start a medical practice, what you need to know. So you can find it on our website, doctorsmanagementgroup.com, and search in the search bar under the blogs. So feel free to look at that. We also have the webinar today, and then we have a workshop for anybody who wants to dive into it, ask a few different questions, really start thinking about, is this the right step? We have a workshop scheduled for next Wednesday. So if you're interested in starting your practice, I highly recommend that you join the workshop to get some of your questions answered. Today, we're going to be focusing on 4 main components of the Proforma. If we have time, I'll show you an example of a Proforma that we have put together for this demo purpose. So we're going to talk a little bit about the overview, like what is a Proforma? How do we use it as a clinician? That might be a term that you've never heard before. What are the ongoing costs versus startup costs, and why is it important to distinguish in a Proforma? What is the difference between cash flow and profit? And how does that help you decide on a go or no-go decision as you're using the Proforma to decide if you're going to start a medical practice? And then the post-launch, you get everything going, you get credentialed. After you open those doors, how is a Proforma able to help continue to guide the practice? And so we'll touch base on these 4 components. So overview of a Proforma. It is a financial tool. It is a document typically done in Excel that uses a certain number of assumptions based on revenue, certain number of assumptions based on cost, certain number of assumptions, in terms of timing, and then really kind of utilizing it's utilized for bankers, for vendors, for insurance quotes, lenders, I mentioned already. And so it is a tool more important than the business plan often, because that tool gets you to understand how many patients you plan on seeing, how many do you want to see, how many you think you can see, what are those costs related to running the practice, and kind of understand that, hey, this is what I really want to do, but it doesn't seem feasible, or this is what I really want to do, and it shows a profit. So that's the whole purpose of the pro forma. In terms of those assumptions, though, you can throw out random numbers or you can dive into the research. And the most successful startups, whether it's a startup from scratch, whether it is an additional service line that your medical practice is offering, both in several occasions, the more research you do, the better your assumptions would be. And when you have that better assumption, you get to get a little bit better details in terms of the numbers. And so that margin is more accurate with the assumptions, when there's better research into it. So anybody can put into random numbers and get a random result. But the more experience you have putting together, the more experience you have with the reimbursement rates, the startup volume of patients, the startup expenses, the more accurate your pro forma is going to be. And ultimately, if you're going to use it as a tool to decide if you're going to start the medical practice, you want as accurate information as possible. So the two main things I've been talking about, one is revenue. That's what you're getting paid from patients, what you're getting paid from payers. If you're doing workers' comp, it's going to be what you're getting from insurance providers as overall. And that revenue is typically a combination of your average reimbursement rates and your average patient volume in a given month. In addition, we like to break that down by service level. So if you have a cash pay service line, if you're doing laser therapies, if you're doing chronic care management, all of those are what we call profit centers. And really, when you break it down by profit center, you can determine, which of those profit centers you want to focus on initially, maybe add them down the road, and what percentage of your population do you think will be using it? Again, these are all assumptions, but they're needed to make a strong pro forma. If you truly believe that 10% of your population that you're going to see is going to get laser therapy once a year or once every other month, then we have to build that in. And that's the assumption that you're making. But if you believe that only 1% would get it every other year, that would be another assumption, right? And so based on the population that you serve currently, based on the knowledge, based on the cash flow of the patients that you're seeing, based on so many factors, there is an assumption to be made about where your revenue is coming and how much you're going to be receiving. The other big assumption on the revenue side is the portion of patients from Medicare versus private pay versus commercial pay versus Medicaid. And that really creates an overall average reimbursement per visit. And so that average reimbursement is, ultimately is typically one number that we want to put in. So an example would be $110 per visit or $92 per visit on average. You might get 130 on some visits, you might get 70 on some visits. But the idea is, what would be that average? And that's what you're going to be basing on. Then ultimately, how many patients will you be seeing on a monthly basis? On the expense side, there's a little bit more fixed nature to it. You can look and see what the current rent is. You can look to see how much you have to pay a medical assistant, the payroll costs. The key about the expense side, again, when it goes back to the assumptions, is really, what do you want the practice to look like? And how much would that cost to look like that? So if you want certain components of your practice, if you want 3 medical assistants to, for every 1 medical assistant per room, or if you want, to have a whole bunch of customer support, that's the assumption that you're making, that you're going to need that many people. And it's really about, hey, I won't start my practice unless I have 3 medical assistants. Well, that might price you out. You might be really hard to cover your costs, for example. Or another big one that we typically see is that a provider wants an office space, but that office space costs $15,000 a month. And we know that you can get an office space from $2,000 a month to $25,000 a month. And it's really about, where do you envision your practice being, what components, how big, and all of those are assumptions that you have to make to kind of make that pro forma come true. And so we would ask a bunch of questions as follow-ups, but the key is, put it down in terms of what you would like to see. And if it makes sense financially and you say, yes, I want that, that's going to help you with your go or no go decision. But if you can't get profitable, then you have to decide, is that too much space or not enough space, for example. Do you need that laser at the beginning, or can you buy it a year or two later? Do you need 3 medical assistants, or can you get away with 1? And so all of those things are part of the discussion to help you formulate, what is that best utilization of your funds, and the practice that you're able to afford. Is that something that you'd be happy with? Just like anything else. The other last couple of components of the expense side, and this is not necessarily on your profit and loss, but it really goes into the cash flow analysis, which is, what are those loan payments? Are you borrowing money from a bank to start up your practice, or are you cashing in a 401k? Are you borrowing from your in-laws or your parents? Like, where are you getting the sources of funding to buy the initial startup costs? And we'll get into that ongoing cost versus startup cost next. All right, so topic 2, the ongoing costs versus startup costs. One of the most overlooked expense items when people are thinking about a startup is, what is it going to cost them to open their doors? And it seems simple, right? But sometimes it's a little bit more trickier than you'd think. And so getting to the point where you can open the doors, everything before that is really classified as the startup costs. There may be one-time fees. And then once you open the doors and you're seeing patients, what are those ongoing costs after? So if you use that kind of start date as the key. And so, you need office furniture for the reception area. You need office furniture, exam room tables. You need the stools. You need the medical supplies. You might also need stuff for in-office procedures that you might need to pay for. You might need scopes that you want to pay for. Another big startup cost is leaseholder improvements. So you found the perfect location, you found the perfect size, but it needs $100,000 worth of work to, more than painting and carpet, right? It's going to need walls moved. It's going to need some sinks installed. That adds up. And, if anyone has ever remodeled a house or built a house, those estimates, can be variable from the actual end result. So what are those one-time results? And that leaseholder improvement portion is probably the largest variable. The second largest variable is, how many toys do you want before you start up? How many lasers, how many procedures, how many scopes or whatever you have in the office. Even on the primary care side, we see more primary care practitioners getting excited about $100,000 or $200,000 machines. And it's really, yes, you could take out a loan to finance them, but that just makes the startup, that a little bit more, expensive. So we think about medical equipment. We talked a little bit about down payments on your rent. So if you're renting on a 5-year lease, you might need to put down 2 months of rent before you even move in. You might have to put down 3 months before you move in, because you have to start the lease in June, but you can't start the practice until August. So those are upfront kind of one-time payments that you have to make before the doors are open. Initial supplies, you don't have to go crazy. Most of the medical supply companies can overnight things within 1 day. So you don't have to build up a reserve of 3 or 4 months worth of stuff, especially if you don't know how fast you're going to use them. EMR costs and setup, oftentimes not too expensive. A lot of the bigger EMRs are allowing you to kind of defer payments until you start seeing patients, which is nice. But at the end of the day, there might be some time. You might need to pay somebody to help with implementation. You might need to hire your practice manager a little bit earlier so that you can get them help, or they can help with setting up the EMR. Credentialing costs. If you're going to pay for a credentialing team to do your credentialing, you're going to have to pay them. And typically that's 4 to 6 months before you would start the medical practice, you'd start the credentialing process. And it is a catch-22. And for anyone who's gone through credentialing, you know that you have to have an address before you can submit credentialing applications, but you need a loan approval before you can sign a lease. And so it's kind of that 3-legged stool that you have to balance at the beginning of the process. You might have to buy some marketing signs. You might want to buy some marketing ads, hand out papers and brochures from that standpoint. And then, kind of last thing, hopefully, it could be that you just need some wallpaper or paint on your walls, office remodeling costs. I kind of talked a little bit about that before. On the ongoing costs. So the ongoing costs, we try to limit and be very stable. There's fixed costs and there's variable costs. The fixed costs are going to be more, the office rent, the malpractice insurance, the payroll for the most part is going to be a pretty fixed amount because you're going to have one or two receptionists, one or two MAs, practice manager on payroll every week. That's pretty much variable. Then there's going to be pretty much fixed costs. Then there's going to be the variable costs. The variable costs might be, the more procedures you do, the more supplies you have to pay for, or, the more you have to pay for people to read imaging if you have an in-house imaging solution. And so on those lasers, there's those dispensable, reoccurring costs on those lasers. And so we want to think about it, the utilities, electricity, is that included in rent or is that extra? And then the overall business insurance, general liability, workers' comp, those type of costs. Marketing, we try to recommend as a fixed cost because you should be investing in your marketing. It oftentimes becomes a variable as money gets tight. Sometimes marketing slows down. As money loosens up, marketing does. So there's some component to being able to be variable, but we do recommend it being more of a fixed approach. All right. And then costs over time. So when we think about cash flowing and the profitable businesses need to cover the revenue needs to be more than the expenses paid in that month. Most practices, if not all practices that are startup, are on a cash basis, which means the money that comes in paid by payers, paid by the patients, and then the money the bills that are going out, the actual payment date. That would be the bills, in that month. The revenue coming in and the expenses going out should be, positive, right? That's the goal of a profitable business. But you could be profitable covering those expenses, but yet may not be cash flow positive because you have a loan payment. The loan payments don't hit the profit and loss or P&L statement. They kind of hit the balance sheet. We'll talk a little bit about that on the next topic. But cash flow positive really is the sweet spot. You're paying for all of your bills, you're paying for all of your balance sheet items, and there's money left over to potentially pay you as the owner, which would be really exciting. The way that startup costs are put onto your business profit and loss or balance sheet is varies depending on your state. Definitely recommend talking to a CPA if you're going to be investing your own money into it. Depending on if you want to put that on as an investment into your business or as a loan to your business, those are above my pay grade, but definitely recommend talking to a CPA about that. And it's really not the pro forma itself is not a perfect science. Sometimes, as I mentioned, there's variables that may be playing a role. There may be months where you get free months of rent, which would be great. So you can, get some profit, for that month, but the rent kicks in month 3 and 4. And so you got to make sure that you're up and running based on that. But it's all based on the assumptions, as we talked about in the first topic. All right, so let's jump over to topic number 3. Kind of talking a little bit about how do you decide a go or no go. I like to refer to that when I work with clients on creating a pro forma for them is really the whole purpose of a pro forma is this a business I want to go all in on? Is it a go? Or is it a business that I would be nervous about investing and spending everything I have to get into it? Or is it no go? And those are obviously part of the extremes. A lot of it is in the gray. And what I try to recommend to everybody who's putting together a pro forma is start with your ideal practice and then decide, is your ideal practice a solution that could work, reasonably work? And using the pro forma, is it reasonable to assume that the revenue is going to be more than the expenses? Is it reasonable that you can cover the loan payments? Is it reasonable that you can get a loan that you need? If you're looking to do marble walls and marble countertops, that might be a really big loan. Is that reasonable? Like, could you even qualify for a loan that big? Versus just finding a subleased office to be able to make it, 2 or 3 years from the kickoff sign. So cash flow and profit are part of the go, no go. And it's about where do you have to compromise and at what levels do you compromise and to still decide to move forward or decide to back out. So from a cash flow, 30 to 60 days after you see a patient is when you get paid from insurance payers, typically after the first 2 months. So I'll caveat that with a business that's up and running, who has been receiving payments from Blue Cross or Aetna, United. Typically, if it's a clean billing, they'll get paid between 30 and 60 days, hopefully a little bit sooner, but 30 to 60 days. Now, in that startup period, before you've received that first Blue Cross payment, that first United, there is typically a longer delay. So those first 2 to 3 months could go over 60 days before you get payment. And that's because you're new in the system, the practice is new, maybe they have to verify the direct deposit, maybe they have to verify that you're a real provider. There's a lot of reasons why they delay those first payments, but once they kick in, they usually catch up, and then it's the job of the AR team, your billing team, your practice manager to make sure you get as close to 30 days on average across all your payers. We know that Medicare pays a little bit sooner. We know that United and Aetna typically pay a little bit later. And so it's a matter of kind of averaging them out to be about 30 days, which means you can work really hard in May of 2026 and you might get paid in June or even July of 2026. And so that delay in payments, is something to keep in mind because when you're starting up, you're going to see patients in that first month, but you're probably not going to get much money being deposited into your business bank account in those first 30 days. And so that first kind of month, 2 month, 3 month, you got to be prepared for that. And that's part of the cash flow versus the profitability. You're making $100 per patient, and you saw 200 patients, and so therefore you should be making money, but that money won't come in until June or July. And so, that's the cash flow component of a business, and using a pro forma, you want to take that in mind. You want to keep that in mind because the patients you see in January, the January has rent, they have expenses. And so you might not have that money because you haven't been paid to you yet. So you got to be able to pay for that. So we always assume about 60 days worth of expenses in our startup loan, just so you have that money for you. But the expenses hit every month, right? And so whether you collected payments from the patients or payers or not, or if you collected enough, you still have those invoices coming in. And so knowing and understanding that is part of is putting together the pro forma and seeing how those numbers kind of fluctuate on the revenue side, but may not fluctuate on the expense side. There's a term I used previously called cash basis, or if I haven't, cash basis is you account for the money in the days, in the months that it hit. So any payments from May 1st to May 31st would be counted in May, even if you saw the patient in April. Accrual basis is the opposite. So accrual basis is you would count the revenue in April, even though you don't cash the check in May. As I mentioned, every startup we work with does a cash basis. And it's not really until you hit, much larger practices that you have to start thinking about accrual, if ever, from that standpoint. All right. So you can be, as I mentioned, profit and loss positive, but you may not have your cash in your bank might go down. You might be cash flow negative. So you start the month with $10,000 and you end the month with $8,000, but you generated revenue, and the difference could be related to those loan payments or credit card payments where or you put in money and you're taking back the money from a personal loan or from a friend. So loan payments are not shown on a profit and loss. They should be shown on a pro forma to help with cash flow, right? You want to see the cash leaving your account, but from a P&L standpoint, they typically don't show up because it's from the balance sheet. And so, keeping that in mind, you can be profitable, but but your cash in your account could be negative at the end of the month compared to the beginning of the month. All right, so within the first 4 to 6 months, you should be expecting to be cash flow positive and profitable. And so if you're not profitable by that fourth month, you're definitely not going to be cash flow profitable, from that standpoint. So the two go hand in hand to an extent. And as I mentioned in that delay, we know you're going to get a little bit behind in those first couple months, but it should catch up, within the first 90 days, assuming you're already credentialed with those payers. In terms of the variables in that 4 to 6 month, part of it is if you sign a 5-year lease, you might get 3 months free rent. And so those first 3 months might be no rent, which should be great. The rent will kick in month 4, and so you have to make sure that you're up and running by then. But you might have needed to burn those 3 months of free rent in the startup phase before you open the doors because of the timing of the lease. And so that is a big variable. We can't assume you're going to get free months. But at the end of the day, typically you can build those into lease agreements. The cost of the startup payroll and the employee volume. And so again, if you're having to hire a practice manager 30 days before you open the practice, then you open the practice, then you add on the medical assistants, that revenue that isn't going to be there to pay that payroll. And so you want to make sure that you have enough reserves to pay the payroll for your medical assistant, your practice manager, the rent. You don't want to get to the third month and not have enough for rent or not have enough for your practice manager. It just makes it a really tough discussion to have. And then those monthly loans, hopefully if you have a loan, there is some free rent built in or maybe interest only, but those loans on that leaseholder improvements, they add up. And if you have to start paying right away a $10,000 loan payment, that's $10,000 of cash flow that's going to be kind of going against you right from the beginning. All right, topic number 4. Yeah, post-launch benefit of a Proforma. All right, so we've talked a little bit about the research around preparing for the Proforma, the assumptions you make on the revenue, the assumptions you make for the expenses. We talked about cash flow and profitability. Now you've opened the doors. You're 6 months in. How can you continue to use that Proforma? Well, along the way, you've probably been updating it with your actual rent, with your actual your profit centers, your actual payroll, how many people you actually brought on. So you can update that along the way, and it will continue to update your calculations along the way as well. One of the biggest tools that I've seen recently with using the Proforma is before you start the practice, you are, you say to yourself and to your spouse and your parents, whoever, it's okay. I can get to 4 months and 5 months and be break even, and I'll be perfectly happy because I'll be running my own business. But what happens is you get to month 4, you have a profit of $2,000, and you get really hard on yourself. You kind of put yourself down. You say, I'm not doing well enough. I'm failing. This happens all the time. We bring up the Proforma and you say, look at you're actually doing better than your Proforma. You were okay with 4 months of not even to get to profitability, and now you're profitable. Congratulations. And so let's look at it. Let's compare it. Let's kind of keep it up to date. Using it as a benchmark to say, hey, you're exceeding or you're falling behind. And the reason you're falling behind is you assumed you were going to see 200 patients in the second month, but you only saw 100. All right, let's work the system. Let's get back on track. Let's adjust. We don't have to wait the whole 12 months. We can adjust in real time, but we are making adjustments based on the assumptions you made previously. So if you assumed you can get to 200 patients, what was the problem? What was the hang up? Was it a bad month? Do we have to re-engineer the marketing side? Patient variability is typically the biggest point. And if you overestimate it or underestimate it, it's going to throw off the numbers on the bottom line. So that reassurance, knowing that you're not a failure or it's not as bad as you think, but also, hey, if we increase by 50 patients next month, you will get to profitability. You will be able to get back on track. And it's about that self-correction mode where you can do it in real time instead of waiting, to the end of the year to do that. And then the most of the time, I would say it's that you're at or better than the pro forma. You just don't realize it. And so that's just that reassuring, pat on the back to say, hey, keep up the good work. All right. So yeah, that's the kind of the overview of the pro forma. What I would like to do is then just give you a little bit of showing of how we structure our pro formas. I have on here a primary care and multi-specialty practice pro forma that I have put together previously and using for an example. And so you can see here it's a 3-year pro forma over 36 months, broken down by month. So a lot of detail, a lot of assumptions regarding patient volume. What are those different profit centers that you're showing? The chronic pain management visits, what are those expenses, the salaries, how does the salaries variable from year to year to year, the rent assumptions, the IT support assumptions, the utilities, the loan payments, and then ultimately what's your ongoing kind of burn rate. And so these are all the components. You want to look at those startup costs. So everything from how much does a table cost to the gauze, those are all good questions to have. But what is going to be the purchase of furniture versus the working capital? These are all things the bank's going to have to know anyway. So you might as well start planning it. And then really, what is that additional research that's special to your practice? What are those codes reimbursing at? What are those costs for the different lasers or anything that you want to add on to the practice itself? You should think about that right away. And so the pro forma itself is made up of a lot of assumptions, and when done well, it should give you a very accurate assumption of where you're going to be at by the end of the first year, by the end of the second year, and by the end of the third year. So with that being said, that was the end of our pro forma. If you'd like to learn more, follow us, doctorsmanagementgroup.com. We'll send you out a link as well for our workshop, which will be next Wednesday. Looking forward to working with you and diving into further any questions that you may have. Thank you so much.